Question 1. A 68-year-old patient with a history of heart failure is scheduled for a CT scan requiring intravenous contrast. Which of the following lab values is most crucial for the technologist to assess before administering the contrast media? A. Hemoglobin, B. White blood cell, WBC, count. C. Serum creatinine. D. Platelet count. Answer, C. Serum creatinine. This question tests your understanding of patient safety, specifically concerning contrast media administration. The keyword intravenous contrast immediately alerts you to potential renal, kidney, implications. Serum creatinine is a vital indicator of kidney function, and impaired kidneys can struggle to filter and excrete contrast media, leading to a condition called contrast-induced nephropathy. Therefore, assessing this value is crucial to ensure the patient's kidneys can safely handle the contrast. Always check renal function labs like creatinine or GFR before administering iodinated contrast to protect your patient's kidneys. Question 2. When performing a lateral projection of the cervical spine, what specific anatomical structure should be clearly visualized and superimposed to ensure proper positioning and avoid rotation? A. Mandibular rami. B. Zygapophyseal joints. C. Articular pillars. D. Anterior and posterior arches of C1. Answer, C. Articular pillars. This question focuses on accurate positioning for cervical spine radiography, a common and critical skill. The keyword superimposed is a strong clue, indicating structures that should align perfectly in a true lateral projection. In a true lateral cervical spine image, the articular pillars, which are the lateral masses of the cervical vertebrae, should be perfectly superimposed. This alignment confirms that the patient's head and neck are not rotated, which is essential for accurate diagnosis of conditions like facet dislocations or fractures. Remember that proper superimposition of the articular pillars is your best indicator for a true lateral cervical spine projection. Question 3. According to the ALARA principle, which of the following practices would be most effective in reducing occupational exposure during a fluoroscopic procedure? A. Standing closer to the patient to improve image quality. B. Limiting the use of lead aprons to short procedures. C. Increasing the beam filtration to harden the X-ray beam. D. Stepping away from the patient and the X-ray tube when not actively manipulating them. Answer, D. Stepping away from the patient and the X-ray tube when not actively manipulating them. This question directly tests your knowledge of the ALARA principle, as low as reasonably achievable, a cornerstone of radiation safety. The keywords most effective and occupational exposure point to practical application of the time, distance, and shielding principles. Stepping away from the primary beam and the patient significantly increases the distance between you and the radiation source, which is the most effective way to reduce dose because of the inverse square law. For instance, doubling your distance from the source reduces your exposure by a factor of 4. Always maximize your distance from the radiation source whenever possible to keep your dose as low as reasonably achievable. Question 4. A technologist observes that the images produced by a computed radiography (CR) system are consistently appearing too dark, even after adjusting exposure factors. Which of the following is the most likely cause? A. The photostimulable phosphor (PSP) plate is cracked. B. The CR reader's laser intensity is too high. C. The automatic rescaling algorithm is miscalibrated. D. The image acquisition workstation monitor brightness is too low. Answer, C. The automatic rescaling algorithm is miscalibrated. This question delves into troubleshooting digital imaging systems, a critical skill for technologists. The keywords consistently appearing too dark and even after adjusting exposure factors suggest a systematic issue beyond simple technique errors. Digital radiography systems use automatic rescaling algorithms to adjust image brightness and contrast, regardless of minor exposure variations. If this algorithm is miscalibrated, it can consistently produce images that are either too dark or too light, even if the initial exposure is technically correct. For example, if the system is designed to rescale to a certain density range but is incorrectly calibrated, it might always make images appear underexposed. When troubleshooting consistent image appearance issues in digital radiography, always consider the system's processing algorithms as a primary suspect. Question 5. During a barium enema procedure, a patient suddenly complains of severe abdominal cramping and feels lightheaded. The technologist notices the patient's skin is cool and clammy. What should be the technologist's immediate priority? A. Administering a bolus of intravenous fluids. B. Elevating the patient's head to improve breathing. C. Lowering the patient's head and elevating the feet, Trendelenburg position. D. Continuing the procedure to complete image acquisition quickly. Answer: C. Lowering the patient's head and elevating the feet, Trendelenburg position. This question tests your ability to recognize and respond to a medical emergency, specifically signs of shock or syncope, which can occur during contrast studies. The keywords severe abdominal cramping, lightheaded, and cool and clammy skin are classic indicators of vasovagal reaction or early shock. Placing the patient in the Trendelenburg position helps to return blood flow to the brain, which can alleviate lightheadedness and prevent fainting. For instance, if a patient feels faint, putting them in this position can improve cerebral perfusion. Always prioritize patient safety and comfort, and be prepared to act quickly in emergency situations by recognizing the signs of potential shock or syncope. Question 6. A technologist is preparing to perform a mammogram on a patient. Which of the following is the most effective method for the technologist to confirm the patient's identity prior to the examination? A. Asking the patient, "Are you Ms. Smith?" B. Checking the patient's name on the requisition form and then asking the patient to state their full name and date of birth. C. Confirming the patient's room number with the nursing staff. D. Verifying the patient's armband against a list of scheduled appointments for the day. Answer: B. Checking the patient's name on the requisition form and then asking the patient to state their full name and date of birth. This question emphasizes patient identification, a crucial aspect of patient safety and professional practice. The keywords "most effective method" highlight the need for a robust, multi-step verification process. The most reliable way to confirm identity is to compare the requisition against the patient's verbal response of their full name and date of birth, which serves as two unique identifiers. For example, simply asking "Are you Ms. Smith?" allows for a simple yes even if the patient is confused or has hearing impairment. Always use at least two unique identifiers that the patient actively provides to ensure you are treating the correct individual. Question 7. Which component of the X-ray tube is responsible for focusing the electron stream towards the anode target? A. Stator. B. Rotor. C. Focusing cup. D. Cathode filament. Answer: C. Focusing cup. This question assesses your foundational knowledge of X-ray tube components and their functions, which is essential for understanding image production. The keyword focusing is a direct clue to the component's role. The focusing cup, which is part of the cathode assembly, is made of nickel and has a negative charge to electrostatically confine the electron cloud, directing it precisely towards the small focal spot on the anode target. Without the focusing cup, the electrons would repel each other and spread out, resulting in a blurry image. Remember, the focusing cup ensures that the electron stream hits the target efficiently for optimal image resolution. Question 8. A radiographer notices a significant increase in image noise on all images acquired using a specific digital radiography detector. All exposure factors appear appropriate. What is the most likely cause? A. The detector is experiencing a physical crack in its housing. B. The detector's image acquisition software has corrupted. C. The detector's charge-coupled device, CD, or flat panel detector, FD, is undergoing degradation. D. The detector needs to be cleaned with a specialized cleaning solution. Answer, C. The detector's charge-coupled device, CD, or flat panel detector, FD, is undergoing degradation. This question tests your ability to troubleshoot digital image quality issues, specifically increased noise. The keywords significant increase in image noise and all images acquired using a specific digital radiography detector point to an intrinsic problem with the detector itself rather than an external factor. Degradation of the detector's components, such as a flat panel detector's photodiodes or a CCD array, can lead to electronic noise that manifests as increased mottle or graininess on images. For instance, aging or damaged detector elements might produce spurious signals. Consistent image noise often indicates a fundamental issue with the detector hardware, necessitating service or replacement. Question 9. When positioning a patient for an AP-oblique projection of the lumbar spine, LPO position, which specific anatomical structures are best visualized? A. Right zygapophyseal joints. B. Left zygapophyseal joints. C. Right intervertebral foramen. D. Left intervertebral foramen. Answer. A. Right zygapophyseal joints. This question assesses your detailed knowledge of spinal radiography positioning and the resulting anatomy visualized. The keyword LPO position indicates a left posterior oblique, meaning the patient is rotated with their left posterior side closer to the image receptor. In an LPO position for the lumbar spine, the right zygapophyseal joints, which are the articulation points between the superior and inferior articular processes of adjacent vertebrae, are best demonstrated. To help you remember, in an LPO or RPO for the lumbar spine, you visualize the zygapophyseal joints farthest from the image receptor. Question 10. A patient presents for a general radiography examination and reports feeling extremely anxious about the procedure. What is the most appropriate initial action for the technologist? A. Quickly perform the examination to minimize the patient's time in the room. B. Reassure the patient that the procedure is quick and painless, and then proceed with positioning. C. Explain the procedure in simple, clear terms, answer any questions, and acknowledge their feelings. D. Recommend that the patient reschedule their appointment if they cannot calm down. Answer, C. Explain the procedure in simple, clear terms, answer any questions, and acknowledge their feelings. This question focuses on patient communication and care, particularly in dealing with anxiety, a common scenario in medical imaging. The keyword most appropriate initial action emphasizes the first and best step to take. Explaining the procedure in an understandable way, addressing concerns, and validating their anxiety. I understand you're feeling anxious, and that's completely normal, helps build trust and can significantly reduce a patient's stress. For example, explaining the sounds the machine makes can alleviate fear of the unknown. Remember, effective communication and empathy are powerful tools for managing patient anxiety. Question 11. Which of the following is an example of an involuntary motion that commonly causes image blur and requires specific techniques to manage in radiography? A. Patient moving their arm during an elbow projection. B. Child crying and wiggling during a chest X-ray. C. Tremors in a patient with Parkinson's disease. D. Respiration during a chest X-ray. Answer D. Respiration during a chest X-ray. This question differentiates between voluntary and involuntary patient motion, a crucial concept in image quality. The keyword involuntary motion specifically refers to body movements that the patient cannot consciously control. While patients can generally control their arms or stop crying, respiration, breathing, is an automatic bodily function. Although a patient can hold their breath, the act of breathing itself is involuntary. Motion from breathing causes blurring of lung markings or the diaphragm on chest X-rays, which is why patients are instructed to hold their breath. Therefore, you must use breath-holding instructions or short exposure times to minimize blur from respiration. Question 12. A technologist observes that the exposure indicator, EI, number on a CR image is consistently very high. What does a high EI number typically indicate in a CR system? A. The image is underexposed. B. The image is overexposed. C. The image has too much noise. D. The image receptor was incorrectly processed. Answer B. The image is overexposed. This question tests your understanding of exposure indicators in digital radiography, which are crucial for assessing image quality and radiation dose. The keyword consistently very high is the direct clue. In most CR systems, a high exposure indicator, e.g., a high S number or a high numerical value depending on the vendor, signifies that the image receptor received significantly more radiation than necessary, resulting in an overexposed image. While the image might appear acceptable due to automatic rescaling, the patient received an unnecessary radiation dose. Always strive to achieve an optimal exposure indicator to minimize patient dose while maintaining diagnostic image quality. Question 13. Which ethical principle is primarily concerned with the equitable distribution of healthcare resources and fair treatment of all patients? A. Autonomy. B. Beneficence. C. Non-maleficence. D. Justice. Answer D. Justice. This question explores the core ethical principles guiding healthcare practice, which are fundamental to professional conduct. The keywords equitable distribution and fair treatment are direct descriptors of the principle of justice. Justice in healthcare refers to treating all patients fairly and ensuring that resources are distributed equitably, without discrimination based on socioeconomic status, race, or other factors. For instance, ensuring all patients have equal access to necessary imaging services regardless of their ability to pay. Always remember that the principle of justice guides us to ensure fairness and equity for all patients in their healthcare journey. Question 14. For an AP projection of the foot, to best demonstrate the tarsometatarsal joints free of superimposition, the central ray should be angled. A. 10 degrees cephalad. B. 10 degrees caudad. C. Perpendicular to the image receptor. D. 15 degrees medial. Answer B. 10 degrees caudad. This question tests your knowledge of specific radiographic positioning, particularly the central ray angulation for foot projections. The critical phrase, tarsometatarsal joints free of superimposition, indicates a need to open up these joint spaces. For an AP projection of the foot, a 10-degree caudad, towards the feet, central ray angle is used. This angle projects the metatarsals away from the tarsals, effectively opening the tarsometatarsal joint spaces for optimal visualization. Remembering specific angulations for foot radiography is key to producing diagnostic images. Question 15. What is the primary purpose of a warming-up procedure for an X-ray tube before high kVp/MOS exposures? A. To ensure the filament is properly heated for electron emission. B. To prevent damage to the anode from sudden thermal expansion. C. To calibrate the generator's kVp and MOS accuracy. D. To clean any debris from the tube's internal components. Answer: B. To prevent damage to the anode from sudden thermal expansion. This question addresses X-ray tube maintenance and longevity, a practical aspect of equipment knowledge. The keyword warming up specifically refers to a preventative measure for the anode. Applying high heat suddenly to a cold anode can cause it to crack due to rapid and uneven thermal expansion, severely shortening the tube's lifespan. A warm-up procedure involves a series of low MS, low kVp exposures to gradually heat the anode. This gradual heating ensures uniform thermal expansion, protecting the anode from stress. Always perform proper warm-up procedures to extend the life of your X-ray tubes and avoid costly repairs. Question 16. A patient is scheduled for a CT scan of the abdomen and pelvis with oral contrast. The technologist is informed that the patient has a known allergy to iodine. What is the most appropriate action? A. Administer the oral contrast as ordered, as oral contrast does not contain iodine. B. Administer an alternative non-iodinated oral contrast agent. C. Immediately notify the radiologist and the referring physician. D. Proceed with the scan without any contrast media. Answer: C. Immediately notify the radiologist and the referring physician. This question tests your critical thinking regarding contrast media safety and proper communication. The crucial information is known allergy to iodine, and the procedure involves oral contrast. While most oral contrasts for CT are not iodine-based, they use barium sulfate or dilute iodinated contrast. An allergy to any contrast is a serious concern. The most appropriate action is to notify the radiologist and referring physician immediately to clarify the type of oral contrast ordered and whether it's safe given the allergy, or if an alternative should be considered. For example, sometimes dilute iodinated contrast is used orally. Always err on the side of caution and involve the medical team when there's uncertainty about patient safety and allergies. Question 17. Which interaction between X-ray photons and matter is responsible for the majority of the scattered radiation produced in diagnostic radiology? A. Photoelectric effect. B. Coherent scattering. C. Compton scattering. D. Pair production. Answer: C. Compton scattering. This question delves into fundamental X-ray physics, specifically photon interactions with matter. The keyword scattered radiation is the key indicator. Compton scattering occurs when an incident X-ray photon interacts with an outer shell electron, ejecting it and causing the incident photon to change direction with reduced energy. This change in direction produces scattered radiation, which degrades image contrast and contributes significantly to occupational dose. For instance, the use of a grid is primarily to absorb this scattered radiation before it reaches the image receptor. Understanding Compton scattering is crucial for implementing effective radiation protection and image quality control measures. Question 18. A technologist is preparing to image a patient with a suspected non-displaced fracture of the distal radius. Which of the following views would be most crucial for demonstrating this injury clearly? A. AP projection of the forearm. B. Lateral projection of the forearm. C. PA projection of the wrist. D. Oblique projection of the wrist. Answer, C. PA projection of the wrist. This question focuses on optimal positioning for specific pathologies, a core skill in radiography. The keywords non-displaced fracture and distal radius point to a common wrist injury. While multiple views are always taken, the PA projection of the wrist is crucial for demonstrating fractures of the distal radius, particularly non-displaced ones, as it provides an unobstructed view of the carpal bones and distal forearm. For example, a Cole's fracture, a common distal radius fracture, is typically well visualized on a PA view. Always ensure your routine includes views that best demonstrate the anatomical area of interest and potential pathology. Question 19. According to Health Canada safety codes, what is the annual effective dose limit for an occupational radiation worker? A. 1 MSV. B. 20 MSV. C. 50 MSV. D. 100 MSV. Answer, B. 20 MSV. This question directly tests your knowledge of radiation protection regulations and dose limits, which is paramount for safety. The keyword annual effective dose limit for an occupational radiation worker is specific to the regulatory guidelines for those exposed to radiation as part of their job. Health Canada Safety Code 35, or its updates, sets the annual effective dose limit for occupational radiation workers at 20 MSV, averaged over a 5-year period, with no single year exceeding 50 MSV. This limit is in place to minimize the risk of stochastic effects, like cancer, from radiation exposure. It is essential to be aware of and adhere to these dose limits to ensure a safe working environment. Question 20. A patient's prior imaging shows significant kyphosis. When performing a lateral projection of the thoracic spine, how should the central ray be adjusted to ensure the entire thoracic spine is included and positioned correctly? A. Angle the central ray 10 to 15 degrees cephalad. B. Angle the central ray 10 to 15 degrees caudad. C. Direct the central ray perpendicular to the T7 vertebral body. D. Increase the source to image distance, SE only. Answer. A. Angle the central ray 10 to 15 degrees cephalad. This question addresses adapting positioning for patient variations, a critical aspect of patient care and image quality. The keyword kyphosis describes an exaggerated posterior curvature of the thoracic spine, which causes the spine to tilt. To properly project the entire thoracic spine in a true lateral view and ensure the central ray is perpendicular to the long axis of the kyphotic spine, the central ray must be angled 10 to 15 degrees cephalad, towards the HED. This compensates for the patient's natural curvature, preventing foreshortening or elongation of the vertebrae. Remember to always adjust your central ray angle to accommodate anatomical variations for optimal image quality. Question 21. Which of the following technical factors directly controls the quantity of X-ray photons produced at the anode? A. Kilovoltage peak, kVp. B. Milliampere seconds, MOS. C. Focal spot size. D. Source to image distance, SE. Answer, B. Milliampere seconds, MOS. This question tests your fundamental understanding of X-ray production and the role of technical factors. The keyword quantity refers to the number of X-ray photons in the beam. Milliampere seconds, MOS, directly controls the total number of electrons flowing from the cathode to the anode, which in turn determines the quantity of X-ray photons produced. For example, doubling the MOS will double the number of X-ray photons produced. While KVP affects photon energy and also quantity indirectly, MOS is the primary and direct controller of photon quantity. Question 22. When preparing for an intravenous contrast injection, which of the following is the most important reason to check for the patency of the four-line? A. To prevent air embolism. B. To ensure the contrast flows smoothly and prevent extravasation. C. To accurately calculate the injection rate. D. To confirm the patient's identity. Answer: B. To ensure the contrast flows smoothly and prevent extravasation. This question highlights a crucial safety step in administering intravenous contrast. The keyword patency refers to the openness and unobstructed flow of the four-line. Checking patency ensures that the forecatheter is correctly placed within the vein and that the contrast media will flow smoothly, preventing extravasation, leakage of contrast into surrounding tissues. Extravasation can cause pain, swelling, and potentially tissue damage. For instance, flushing the line with saline before contrast injection confirms proper venous access. Always verify for patency immediately before injecting contrast to protect the patient from potential harm. Question 23. A technologist observes a Moore artifact on a digital image, characterized by a wavy pattern. What is the most likely cause of this artifact in a computed radiography (CR) system? A. Overexposure of the image receptor. B. Insufficient cleaning of the photostimulable phosphor (PSP) plate. C. Grid lines running parallel to the laser scanning direction. D. Detector array malfunction. Answer: C. Grid lines running parallel to the laser scanning direction. This question focuses on recognizing and understanding common artifacts in digital radiography. The keyword Moore and the description wavy pattern are direct indicators of a specific type of grid error. A Moore artifact occurs when the frequency of the stationary grid lines is nearly parallel to the laser scanning frequency in the CR reader. This interference creates a visible wavy or superimposed pattern on the image. For example, using a grid with an incorrect grid frequency for the CR system or improper grid alignment can lead to this artifact. Ensure your grid is compatible with your digital system and properly oriented to avoid Moore patterns. Question 24. A patient is scheduled for a lumbar spine series. Before beginning the examination, the technologist asks the patient about the possibility of pregnancy. This action aligns primarily with which ethical principle? A. Autonomy. B. Beneficence. C. Non-maleficence. D. Veracity. Answer: C. Non-maleficence. This question connects a practical clinical action to its underlying ethical principle. The keywords possibility of pregnancy and the implication of avoiding harm directly relate to non-maleficence. Non-maleficence is the ethical principle of doing no harm or do no evil. Asking about pregnancy before an X-ray ensures that a potential fetus is not exposed to radiation, thus preventing harm. For example, if a patient is pregnant, alternative imaging might be considered or the examination postponed. Always prioritize the principle of non-maleficence by screening for pregnancy and taking all necessary precautions to protect your patients from radiation exposure. Question 25. Which of the following image quality factors is primarily affected by the size of the focal spot? A. Image contrast. B. Receptor exposure, density. C. Spatial resolution, detail. D. Image noise. Answer: C. Spatial resolution, detail. This question tests your understanding of the relationship between X-ray equipment components and image quality. The keyword focal spot size directly impacts how sharp or blurry an image appears. The focal spot is the area on the anode where electrons hit and X-rays are produced. A smaller focal spot creates a sharper image with better spatial resolution, or detail, because it reduces geometric unsharpness, penumbra. For instance, mammography uses a very small focal spot to achieve high-resolution images of fine breast tissue. To optimize image detail, select the smallest focal spot size appropriate for the procedure and image receptor. Question 26. When assisting a patient with limited mobility from a stretcher to an imaging table, what is the most important safety precaution for the technologist to take? A. Ensure the patient is wearing non-slip socks. B. Have additional staff members present to lift the patient. C. Lock the wheels of both the stretcher and the imaging table. D. Explain the transfer procedure to the patient in detail. Answer: C. Lock the wheels of both the stretcher and the imaging table. This question focuses on patient transfer safety, a critical aspect of preventing falls and injuries in the imaging department. The keywords "most important safety precaution" highlight the foundational step in any patient transfer. Locking the wheels of both the stretcher and the imaging table prevents accidental movement during the transfer, significantly reducing the risk of a patient fall or injury. Even with multiple staff, if the equipment shifts, an accident can occur. Always ensure all mobile equipment is securely locked before initiating any patient transfer. Question 27. What is the primary function of a collimator in diagnostic radiography? A. To remove low-energy X-ray photons from the beam. B. To focus the X-ray beam onto the image receptor. C. To restrict the size and shape of the X-ray beam. D. To convert X-ray photons into light photons. Answer: C. To restrict the size and shape of the X-ray beam. This question assesses your knowledge of basic X-ray equipment and radiation protection. The keyword collimator specifically refers to the device that shapes the X-ray beam. The primary function of a collimator is to limit the X-ray field size to only the area of interest, thereby reducing patient dose by minimizing the amount of tissue exposed and reducing the production of scattered radiation. For example, collimating tightly to the lung fields on a chest X-ray reduces dose to the patient's shoulders and abdomen. Always remember to use the smallest possible field size to adhere to the ALARA principle and improve image quality. Question 28. A patient scheduled for an MRI examination has an implanted cardiac pacemaker. What is the most appropriate action for the technologist? A. Proceed with the MRI, as pacemakers are generally MRI compatible. B. Verify if the pacemaker is MRI conditional and follow specific safety protocols. C. Administer a sedative to the patient to prevent pacemaker malfunction. D. Immediately cancel the MRI and reschedule for a CT scan. Answer: B. Verify if the pacemaker is MRI conditional and follow specific safety protocols. This question is critical for MRI safety, which involves strict screening for metallic implants. The keyword implanted cardiac pacemaker presents a significant MRI contraindication unless specific conditions are met. While some newer pacemakers are MRI conditional, meaning they can be scanned safely under specific conditions, many older ones are absolute contraindications. Therefore, the technologist must verify the exact model of the pacemaker and follow detailed, specific safety protocols, which often includes a cardiologist's approval and reprogramming the device. Never assume an implant is safe for MRI, always perform thorough screening and verification. Question 29. During a portable chest X-ray in the intensive care unit, ICU, the technologist is unable to achieve the standard 180 centimeters, 72 inches. Source to image distance, SID. How will a reduced SID primarily affect the image? A. Increased patient dose. B. Reduced image contrast. C. Increased magnification of structures. D. Decreased spatial resolution. Answer, C. Increased magnification of structures. This question tests your understanding of geometric factors affecting image quality, particularly when adapting to challenging clinical environments like the ICU. The keyword reduced SID directly relates to the distance between the X-ray tube and the image receptor. When the SID is reduced, objects within the patient are further magnified on the image because the X-rays diverge more acutely. For example, a heart appears larger on a portable chest X-ray taken at a shorter SID compared to a standard 180 cm PA chest X-ray. Always be aware that a shorter SID will result in increased magnification and potentially altered shape of anatomical structures. Question 30. Which of the following conditions represents a breach of patient confidentiality? A. Discussing a patient's imaging results with the referring physician. B. Sharing a patient's medical history with another healthcare professional involved in their care. C. Reviewing a patient's previous imaging studies for comparison purposes. D. Discussing a patient's diagnosis with a colleague in the cafeteria where others can overhear. Answer, D. Discussing a patient's diagnosis with a colleague in the cafeteria where others can overhear. This question addresses a fundamental aspect of professional ethics and legal responsibility, patient confidentiality. The phrase breach of patient confidentiality refers to the unauthorized disclosure of protected health information. Discussing a patient's diagnosis in a public place like a cafeteria, where others not involved in their care can easily overhear, constitutes a clear violation of privacy regulations like HIPAA in the US or similar privacy legislation in Canada. For example, sharing details about a patient's cancer diagnosis in a public hallway is inappropriate. Always ensure patient information is discussed only in private, secure settings and solely with individuals who have a legitimate need to know.